Patrick is a 78-year-old male who has worsening of his left-sided heart failure and COPD. He appears tired, coughs regularly, and suffers from dyspnea. His legs are swollen from the knee down. Patrick was previously a smoker. He quit in his early 60s. He has a history of myocardial infarction. His current observations and body size measurements include blood pressure 135/85 mmHg, heart rate 155 bpm, weight 95 kg, height 180 cm, and waist circumference 104 cm. Shortness of breath, dyspnea, and wheezing are the common symptoms of COPD. The factors that could have contributed to his development of COPD is being an ex-smoker for more than 40 years and environmental factors. Long-term exposure to air pollution, dust, fumes, secondhand smoke, and chemicals can cause COPD. Rapid or irregular heart rates are symptoms of heart disease. Smoking, overweight, hypertension, age, and myocardial infarction were identified as factors contributing to the development of left-sided heart failure. Patrick's BMI is 29.3 and has a waist circumference of 104 cm. Patrick is considered overweight. People with a waist circumference over 101 cm have increased chance of a heart disease because of the excess abdominal fat. Lack of exercise and unhealthy diet are possible contributors to his weight gain. The extra weight increases the heart's muscle workload, causing elevation in heart rate. Overweight has been linked to hypertension and an enlarged left ventricle, increasing risk of left-sided heart failure. Smoking causes permanent damage to the air sacs, causing irritation to the trachea and larynx. Cigarette smoke contains harmful toxins. Toxins inhaled directly into the lung over a long time can lead to severe lung irritation and trigger onset of COPD. Less air will flow in and out of the airway due to the stiffening of the air sacs, deterioration of the walls between air sacs, thickening and inflammation of the airway walls, and increased production of mucus in the airways causing air obstruction. Overweight people are likely to have high cholesterol and high blood pressure. Too much cholesterol in the bloodstream will result in clots formation. Blood clots creates clogs in the bloodstream, causing heart attack. To compensate for the heart's weakened state and the need to pump blood to a larger body surface, the heart muscle must beat harder and faster to meet the body's oxygen demands. The excess fat can also restrict blood flow in the arteries and veins. Hypertension causes the heart to work overtime and to beat harder to pump blood throughout the body. Over time, the extra exertion can make the heart muscle stiffen or become too weak to efficiently pump blood. Men over the age of 50 are more at risk of developing left-sided heart failure if they have previously suffered from a heart attack. Having a past history of myocardial infarction increases Patrick's risk. A heart attack occurs when the arteries supplying blood to the heart get blocked. The lack of oxygen and nutrients damage the heart's muscle tissue. Part of it dies. The damaged heart tissue does not contract well, which weakens the heart's ability to pump blood. Carbon monoxide from cigarettes put a strain on the heart by making it work faster. It also increases risk of blood clots formation. Chemicals from cigarette damage blood vessels, narrow arteries, raises blood pressure, and reduce the amount of rich oxygen blood circulating to other organs. COPD and left-sided heart failure may have developed independently due to different reasons, but have been found to influence the severity of each condition. The left ventricle is responsible for pumping rich oxygenated blood throughout the body. When blood is not being efficiently pumped out, instead it backups into the lungs, causing fluid buildup and shortness of breath. Right-sided heart failure is usually triggered by left-sided heart failure. Right-sided heart failure occurs due to the left ventricle becoming weakened or stiffened. It loses the power to efficiently pump blood to the rest of the body. As a result, blood is forced back through the lungs, weakening the right side of the heart, causing right-sided heart failure. A history of myocardial infarction increases his chance of developing right-sided heart failure. Myocardial infarction causes the inflammation of the heart and weakening of the heart muscle. Right-sided heart failure can also occur in response to abnormally low level of oxygen as a result of oxygen demand due to COPD. Patrick's sodium level, high density level, low density level, and triglycerides level are out of range. This may be due to his diet high in sodium and fat, increasing his cholesterol level. Patrick's potassium level is slightly high due to possible dehydration or his diet rich in potassium or his kidneys failing to remove extra potassium from the body. Intake of calcium deficient diet may be the reason for his low calcium level. An imbalance in sodium, potassium, and calcium affects the neurological function as they are essential to conduct electrical impulse along the cell membrane in neurons. Glucose level is high due to possible diet consisting of sugary items. Abnormal level of glucose and potassium level are more likely to be associated with diabetes. Hemoglobin level is due to possible lack of oxygen intake through the capillaries throughout the body or possible iron deficiency. Anemia, a condition defined by abnormal low hemoglobin levels, is a potential risk factor for cognitive impairment and dementia that is not only common but also increases in prevalence with older age and may later lead to the development of Parkinson's disease. Arterial blood gas test measures oxygen and carbon dioxide levels in blood. ABG can be ordered as a patient is feeling tired, has a smoking history, and has dyspnea. The normal range of PaO2 is between 80 and 100 mmHg. The PaO2 level expected in Patrick would be less than 80 mmHg, as there is an insufficient amount of oxygen being breathed in and passed throughout the body. The normal range for PaCO2 is between 35 and 45 mmHg. The PaCO2 level would be high above the range of 45 mmHg, as there is no gas exchange occurring in the alveoli and carbon dioxide is being retained.